Good morning, everybody, and welcome to the 30 Minutes Express webinar on dehydration and dryness. My name's Amanda Malden-Brown, and I'm the Clinical Educator for Queensland. Now, what will we be covering today? Well, we're going to be looking very briefly at the functions of the skin, and then we're going to be looking at what causes dryness and dehydrated skins and looking at the correlation between those two conditions. We're also going to be looking at how to treat and prevent these skin conditions, and then finally looking at the different moisturizers and hydrators that are sold by AST and that are in our wide range of skincare products. So we'll be looking at each of the individual product ranges and their specific products to treat these conditions. So let's just recap on the skin. We know that the skin is the largest organ in the body. It makes up around about 16% of our body weight, and it is on average 1 millimeter thick. As we know, it consists of 3 layers. We have the epidermis, which is at the top. We have the dermal area, which is in the center, and then we have the hypodermis, which it makes up the fatty tissue and the sort of the cushioning within our skin. And what we also know is that our bodies are made up of around about 60% of water, and it does depend on who we are. So males do tend to carry more water than females, and obviously children considerably more water as well. As we age, that water content within our body reduces significantly. So we just need to just revisit the cross-section of the skin. And as we know, we're looking at the different areas, as I mentioned, the epidermis, the dermis, and the hypodermis. We know that all of these areas will have significant levels of water in them. And then, of course, we look at the cell. Now, the cell is a very important process within our skin. It is a cell that is responsible for stimulating cell turnover and makes up our tissue, certainly within the skin. And what we know about the cell is that the membrane of the cell requires ceramides and fatty tissue, not fatty tissue, ceramides, fats and lipids. And within the center of the cell, we're also requiring a significant amount of water. So both the skin and cells are responsible for holding water and also require ceramides, fats, lipids, etc. So let's just go back and revisit the function of the skin. Well, why do we have that skin? Well, we know that it's there in order to protect us from bacteria and infection, etc. It protects us from dehydration. So the skin is there to prevent that water from evaporating from us. It's also responsible for regulating body temperature. It is a sensory. It is a sensory organ, so it's responsible for temperature, pressure, and also pain. And what we also know, particularly in skincare, is it has an ability to absorb. So there are certain agents that will be penetrated through the skin, and more particularly, obviously, we're concerned about our skincare products. There is an excretion function of the skin whereby water, salt, and urea is excreted through the sweat within the skin. And we also know that the skin is responsible for synthesis of vitamin D and is essential for calcium phosphorus absorption as well. So what is dry and dehydrated? Well, we know dry skin is skin that lacks oil. We also know that dehydrated skin is skin that lacks water. And as we also know is that both those conditions are closely connected to each other. So our skin, as we mentioned earlier, is a waterproof barrier protection. We know that our stratum corneum, the top layer of our skin, contains lipids, fatty acids, ceramides, the cement that keeps those corneocytes anchored together, and they're in a form of a brickwork. This brickwork, or mortar that we call it, combines to form a waterproof moisture barrier called the natural moisturizing factor. Now we know that as the NMF. And what that's doing is minimizing the water loss and evaporation of water from the skin. So keeping the skin, the water content within the skin, and keeping it nice and moist. Very important process in our protection. We also have what we call the acid mantle. Now, this is the outermost layer of the moisture barrier, and it is slightly acidic. And we know that if that acidic barrier is compromised in any way, our skin becomes prone to bacterial infection. It becomes prone to dehydration, roughness, irritation, and noticeable flaking. So our pH of the skin is very important to maintain in order to protect us and to also assist in the destruction of and prevention of bacterial infection as well. So what we need to do is we need to keep the epidermis constantly lubricated so that we're able to protect the deeper layers and obviously prevent that transepidermal water loss, known as TEWL. And this is achieved by the secretion of our sebaceous glands. They secrete and use the hair to pull up onto the surface and perform a function of protection on that surface, not only keeping the skin hydrated, keeping the skin hydrated, preventing water from evaporating, but also keeping that skin moist as well. When the secretions become compromised or reduced in any way, then obviously the skin barrier function is affected. So what happens? Well, the skin becomes very dry and becomes very rough and flaky. We do often get an increase in sensitivity, so the skin can be quite reactive to touch and to sensation as well. So it can be very sensitive to products, it can be sensitive to touch, it can sting, and we get that sort of slightly itchiness as well. The skin can also become very dehydrated, and under a woods lamp, that's very that is obvious through a sort of a purple hue sitting on the skin, and we know that the skin in those instances is dehydrated. So dry skin. Dry skin occurs when, obviously, as I mentioned before, when the sebum, the oil, is not sufficiently secreted onto the surface of the skin. And the skin texture may appear rough, flaky, and dull in appearance. What we know about lack of oil within the skin is that when a skin becomes very dry, it can be prone to wrinkles and anything from sort of fine lines to deeper wrinkles. And that we also know that in a more oily skin, we notice that they tend to age much slower. Also, we notice that men tend to have a more oily production than women. And unfortunately, when women reach menopause, the estrogen levels within the skin deplete and lower, and we find that the skin becomes more dry and dehydrated as a result of that dramatic fall in estrogen levels. So most dry skin is actually caused by environmental exposure, and that breaks down the barrier and causes the moisture from the skin to leach out. And the factors that can cause these two conditions are both are certainly the weather. We know that in the drier winter months, when the temperatures lower, they become colder, and the humidity levels lower, we find that our skin dries out much quicker and becomes more dry in oil as well as water content as well. We also know that central heating and air conditioning is a huge factor, particularly in Australia, where the central heating is drying out the skin, certainly reducing the oil and also evaporating water from the skin. So certainly air conditioning units are responsible, and so is central heating, any form of excessive heat in an environment that we're sitting in constantly. Lifestyle is also important. When we have a diet that is low in fat or fat-free diets, it actually deprives the body from the most important essential fatty acids. It is a critical part of the healthy functioning of our bodies. We require essential fatty acids both in the epidermis, within the cement, but also within our cells. Our cell membrane requires essential fatty acids to keep them waterproof and healthy and strong. Drugs and alcohol are also responsible for drying out our skin, as well as smoking, and also drugs such as diuretics, antihistamines, and Accutane as well. So commonly we see when patients are on medication that their skin does seem to have that visible dryness and dehydration associated with it. So what is the function of a moisturizer? Well, we know the function of a moisturizer is to lock in the moisture by forming an occlusion on the top layer of the epidermis. So it is an oily substance that we apply to the skin that will absorb into the epidermis, but also will sit on the surface of the skin and form a barrier, preventing the weather and the cold and the external elements attacking it, but also preventing the water from leaching out of the skin as well and dehydrating the skin. A lot of moisturizers do contain not only emollients, which is what we're talking about, but also hydrators as well. So you see many moisturizers containing both hydrators and oil content. So things like your hyaluronic acid are your hydrators, your glycerine, urea, etc. And often you'll find those in a moisturizer. And moisturizers can come in an oil in water base or also a water in oil preparation. So depending on how heavy and how much oil is required will depend on which system they will use. So typically an oil in water will be a more oily substance than a water in oil. So what are the key moisturizing ingredients that we find in our moisturizers? Well, our occlusive agents such as shea butter, we find those in a lot of our products, and shea butter is beautiful. It's incredibly moisturizing, and our skin really enjoys the shea butter. It tolerates it extremely well. We also require things like vitamin E and essential fatty acids, and we find vitamin E present in a lot of our products, particularly moisturizers, and also some of our EFA as well. Humectants like hyaluronic acid are very important. Hyaluronic acid will hold and water and in incredible high in density. So very important in keeping the water content as well in the skin, as well as moisturizing. And then things like ceramides are really important in order to keep that natural moisturizing factor intact. So ceramides, as I mentioned earlier, the cell membrane requires ceramides, and ceramides are also required in the mortar or the cement within the corneocytes in the stratum corneum. So very important ingredient to find in our moisturizers in order to keep it nice and watertight. AHAs are also used, and in particular, we look at an ingredient called lactic acid. And what is fabulous about lactic acid is it has an ability to hydrate cells. So it actually increases the ceramide within a cell membrane. So lactic acid is fabulous because not only is it able to rake and stimulate basal cell turnover, but it's also hydrating that skin at the same time. So, we do use our lactic peels quite a lot to keep and maintain the hydration and the oil within the skin. So what about the hydrating ingredients? Well, we have things like hyaluronic acid. As I mentioned, that holds considerable amount of water. Lactic acid, as I mentioned, will help to increase ceramides around the cell membrane and thereby supporting and ensuring the water is maintained within a cell, as well as keeping the water content within the skin, certainly the epidermal layer. Sodium PCA is also a hydrator and is found in a lot of our products. Niacinamide, our Barocca of skincare, that also is an excellent ingredient used to maintain water content within skin. Niacinamide it is a vitamin B3, does lots of other wonderful things, but particularly useful for your more dehydrated skins. And is found in a lot of moisturizers to help to control that dehydration. Urea is also found in a lot of products, and also glycerine as well. Glycerine has an ability to bind water to it, so it draws water down into the skin. We've also got things like algae. We've got amino acids as well. Now, amino acids form 40% of the natural moisturizing factor and again are commonly used in products in order to increase hydration levels within the skin. And also, we mustn't forget how important it is to drink plenty of water. So it is suggested that we maintain our water intake regularly throughout the day. Now, unfortunately, even though water is very important in order for us to take it in and to drink it, we can't always guarantee that the water will go to our skin. So what we know is that it is incredibly important that we put hydrators on the surface of the skin in order for it to get to the area that we want it to get to. We cannot rely on the body to do that for us. What we also know is that when we have a significant dehydrated cell within our skin, it will divide and subdivide through mitosis and reproduce two dehydrated cells, and those go on to produce dehydrated cells. So we know that in order to correct this, it is important that we put hydrators on the skin. We cannot rely on our body to do that for us. And we typically see that when we're analyzing people's skin who tell us that they drink significant amounts of water. And yet when we look under the Woods lamp at their skin, we can still see that dehydration present in the skin. And that's telling us that the skin is not functioning properly. We actually need to be putting hydrators on it. We cannot rely solely on the intake of water. And unfortunately, that's how the body works. So what are the products in our ranges that are moisturizers and hydrators? Well, in the Aspect range, we have the beautiful Phytostat. That is our light moisturizer. It contains emollients. It also contains centoline, which is helps to stimulate the collagen production. But ultimately, that is a moisturizer that will prevent evaporation and also maintain an oil content within the skin. So it will address both dehydration and dryness within the skin. Now, Extreme B17 is your vitamin B3, your niacinamide, and that is responsible for your hydration, so increasing ceramides within the skin. So Extreme B17 is your hydrator. Eye Lift 3 we're looking at is both. So it's going to moisturize the skin as well as hydrate the skin around the eye area. So they're the three main products within the Aspect range that deal with dryness and dehydration. Then we move on to Aspect Doctor. We have the Resveratrol cream, which is our moisturizer. We have the Multi B Plus serum, which is our niacinamide, that is our hydrator. And then finally, Eye Lift, which is both hydrating and moisturizing at the same time. Now, within the Aspect and Aspect Doctor range, we have what we call the Gold range. And within that range, we have things like the Hydra Shield. Now, this is a moisturizer with an SPF. So here we have something that is preventing water loss within the skin, hydrating, drying the skin, moisturizing the skin, as well as providing some protection. Then, of course, we've got the hydrating mask. This is a beautiful mask during the winter months, applying it anything from once a week to up to 3 times a week. And the hydrating mask also contains emollient, so it deals with the dryness as well as dealing with the dehydrator. So it's got things like hyaluronic acid in it, glycosaminoglycan, so deals with the water content as well. So the hydrating mask, brilliant as an additional treatment that can be done at home or within clinic as well to treat both dryness and dehydration. Now, when we look in the teen facial lotion, we notice that this is our moisturizer for our teenagers. So this is a moisturizer that also contains corrective ingredients as well, but it does contain things like sodium PCA and moisturizers to help keep that water content within the skin and keep the skin moist. And then finally, within the Aspect and Aspect Doctor range, we have just launched the SMC. Now, this is called the Super Moisturizing Complex, and this is a very high level of moisturizing content that also contains apple stem cells. Now, we've just launched this recently in the last few days, and it's a high moisturizing content with apple stem cells. Very exciting. It comes in the same bottle as our Phytostat, and it sits in the Gold range. Now, within the cosmetics and the Results RX, in the cosmetics range, we have the beautiful emulsion. Now, emulsion is wonderful. It's a very high moisturizing content, but it also contains lots of antioxidants in there as well. It's beautiful. So excellent for dry skins. Then we have the Phyto Harmony. Now, your Phyto Harmony is suitable for menopausal skins. And we mentioned earlier about how menopause does affect both the oil and the water content within our skin. Unfortunately, the lower estrogen levels affect our skin quite significantly. Phyto Harmony is brilliant because what it's doing is not only is it moisturizing the skin, but it's also ensuring it has phytoestrogens, so it has plant-based estrogens, so it helps to maintain and monitor the estrogen levels within the skin. So it's a beautiful moisturizer for anybody who's reaching menopause age. Then we have the Phyto Clear. Now, the Phyto Clear is a moisturizer that is suitable for the more acne, greasy type of skins. This is a beautiful moisturizer because what it doesn't do is leave that greasy film on the surface of the skin. So it is moisturizing the skin, hydrating the skin without leaving that greasy film that often your more acne, greasy skins don't want. They don't want that greasy film on the surface of the skin. And at the same time as moisturizing, this has an ability to help fight the papules and pustules within the skin. It also has things like pregnenolone in it, which is a testosterone blocker, which we know testosterone and androgens are responsible for, the condition of acne. So fantastic moisturizer for your more acne, greasy, papular, pustular type of skin. Then we've got Hydrate Plus. Now, Hydrate Plus is a moisturizer, but also contains an SPF 15. So this is a great daytime, evening time product. It can be used at nighttime as well, but predominantly obviously during the day because of its SPF, but it is a moisturizer. So it's helping to maintain an oil content on the skin. Now, Mystic is a spritz that you spritz over the face to maintain hydration. So this can be it's a sort of water-based spritz container, and it can be spritzed over the top of your makeup during the day. It's excellent for those that spend time in air-conditioned environment, air hostesses, people that spend a lot of time on planes, because you can just spritz this hydrator over the skin, over the top of your makeup as often as you like, just to hydrate the skin. And obviously, as we mentioned earlier, air conditioning and certainly aeroplanes, the pressure and the air conditioning in aeroplanes does dehydrate skin quite significantly. Now, Pure Protection is a sunscreen, but also has a moisturizer in it. So it can be used during the daytime to not only keep the skin moist, keep that oil content in the skin, but also protect it from the UV. Then we've got things like Opticrystal. Now, this is the eye cream for cosmetics. It has beautiful emollients in it, as well as stimulating collagen as well. And it's a beautiful color. It's gorgeous. So this is an eye cream. A very small quantity must be used. If you use too much, it can be a little bit sticky, and has significant results in reducing fine lines and wrinkles and puffiness and dark circles around the eyes. It's very, very popular. So then we move on to Results RX. Now, Results RX has a product called X Age. It's a beautiful moisturizer containing hydrators, containing antioxidants, containing collagen stimulators. It's like your synergistic blend of everything you need to overcome and to prevent aging process. It's a moisturizer and it's used morning and night. It also contains a little bit of vitamin A in there as well. It's very beautiful. Results RX also Results RX also has a product called Eye Doctor, and that is similar to Opticrystal, where it is a hydrator and a moisturizer for the eyes, but also contains a small amount of vitamin A to help stimulate and repair cells. It is applied to the eyes morning and night, and will reduce fine lines, dark circles, deeper lines, and puffiness as well. Now, Protect is your moisturizer that also contains an SPF 15. Pure Protection, as the same as cosmetics, is your sunscreen with a moisturizer in it. So it helps to maintain that the oil content within the skin, as well as protecting it from the UV. Then we move on to PCA. Now, PCA is, again, a beautiful range containing a lot of wonderful serums. And one of the most important serums within that range is a serum called the Hydrating Serum. So this is specifically targeting dehydrated skins. It is a serum. However, we do find it has a slight emollient effect. So it can, in some cases, be used without a moisturizer. If the skin has plenty of oil but is just dehydrated, this is a fantastic serum. Then within the PCA, we have lots of moisturizers. We've got the Pre-Peel Hydrating Balm, which is a beautiful light moisturizer. We have the Rebalance, which is for your more sensitive skins, but is a fantastic moisturizer. Collagen Hydrator, again, this one is a moisturizer, but is also helping to stimulate collagen as well as maintaining the water content within the skin. So is a great anti-aging moisturizer. Then we've got Silk Coat Balm, which is very hydrating and very moisturizing and is great for those more compromised skins. Eye Excellence is the eye cream, which is a moisturizer and a hydrator, will reduce fine lines and wrinkles. And then finally, within the PCA range, we have the beautiful Body Therapy. Now, this is a fantastic body moisturizer that also it deals with the oil content, so it moisturizes the skin as well as hydrates the skin. And it also has a little bit of lactic acid in there as well, so it increases the ceramides, builds up the water content within the skin, as well as slightly rake the surface of the skin as well. It's a beautiful product, that one. Then moving on to Skin Medica. Skin Medica has a wonderful hydrating complex. It has a beautiful feel to it. And this is a hydrator. So this is maintaining the water content within the skin. So similar to PCA with a hydrating serum, the Skin Medica have also their hydrating. So this is a product that specifically targets dehydrated skins, and we typically see that in most skins. Also can be used without a moisturizer if the skin has a lot of oil content in it. So if you've got a very greasy skin, both the hydrating serum in the PCA and the Skin Medica can be used without a moisturizer. Then we've got the Dermal Repair Cream. Now, this is the Skin Medica Moisturizer. It's a beautiful, rich moisturizer, which will also contains hydrators in there as well. The TNS Eye Repair. Now this one is the eye cream, but also contains growth factors as well. So it's helping to stimulate collagen as well as moisturizing and also hydrating the eye area. So reducing fine lines, wrinkles, puffiness, and dark circles. It's very, very effective, this one. Then we've got the TNS ceramide. Now, this is an interesting product because this one is infusing ceramides into the skin. So, as I mentioned earlier in the presentation, ceramides are an integral part of the natural moisturizing factor and the maintaining the fats and the lipids within the skin. So ceramides are found certainly in the cement or the glue between the cells, and also on the cell membrane as well. So again, when you have a very dehydrated skin that's lacking oil as well, this is a fantastic serum to apply, certainly underneath your dermal repair cream, but it can also be used on its own as well. And then finally, we have the TNS body lotion, which again is a hydrator, is a moisturizer as well. And that's a beautiful product as well. It also contains growth factors, so it enables the skin to produce collagen as well, so tightens the skin. And then finally, and we are coming towards the end, and I know we're running out of time. And finally, we have the Societe. Now, Societe has the Transforming Skin Complex. That's a very moisturizing cream. So this is for your very dehydrated, compromised skin. It also, Societe also contain the Skin Hydration Complex. So this is a beautiful serum that is used to maintain and reduce dehydration within the skin. So it can be applied underneath your Transforming Skin Complex, or it can be used on its own. So that one is dealing with the lack of water within the skin. Then we have Prime and Defend. Now, Prime and Defend is a moisturizer with an SPF, but it also has a slight tint to it. It has a slightly silicone finish, so it's a beautiful moisturizer maintaining the oil content within the skin, protecting it from the UV, but at the same time giving it a little bit of color to the skin. So it's excellent for those who perhaps don't want to wear makeup, say at the weekend, because it has that slight tint to the skin and a beautiful feel on the skin. It has a sort of silicone finish to it. So it's a lovely moisturizer, that one. And then the Societe also has what we call the Ultimate Eye Lift Duo. So it has two products in there. One is responsible for hydrating the eyes and the other for moisturizing, and you use one after the other. Very effective, great results with that product. And it's quite an ingenious little sort of applicator as well. It's quite cute. It has a little ball on it and it rolls onto the eye area. And then finally, within our ranges, we have what we call the range called the Physician's Complex. Now, within that range, we have two moisturizers. One is the Nectar Firm. So this is a moisturizer specifically for the neck area. It is the only product in our ranges that is specifically designed for the neck area, and it is a fantastic product. Everyone should be on Nectar Firm. I'm a firm believer of Nectar Firm. Then we have Tiamine, which is an eye cream. So this is a moisturizer. It's a hydrator. Its claim to fame is that it helps to reduce dark circles as well. It has vitamin K in there, so helps to recede and contract those blood vessels. So we've seen significant results in dark circles, puffiness, fine lines, and wrinkles within that product. And then finally, we have a product in our tanning range called Scent Secure. Now, our tanning range is Zentan, and we have a body moisturizer that helps to reduce that smell of the tanning products. This has a molecule that locks itself around the scent within the tanning products, and it is also a high moisturizing content. So this is used alongside your sunless tanning products in order to prevent streaking within the tan, and also enable it to be longer lasting and keep the skin hydrated at the same time. So we've now come to the end of our presentation on dryness and dehydration. But before we go, I will give you the opportunity to ask questions, and you can type out questions on the question panel. But before you go, I just want to thank you for joining me today and let you know that the next 30-Minute Express webinar will be on the 14th of June at 10 a.m. And the topic that we're going to be covering will be antioxidants. Now, just to remind everyone that the password for all our webinars is ADV Skin with a capital A. And I've put that in bold letters at the bottom. So that concludes our presentation. So if anybody has any questions, please feel free to type in your questions on the question panel, and I'll answer them to the audience. So I'll give you sort of 5 minutes or so. Okay, well, we haven't got any questions coming through, so I'll conclude the webinar today, and thank you very much and speak to you all soon. Bye-bye.